All right. Well, hello, everybody. Welcome to the Masters of Science in Clinical Counseling program information session here at Cal State San Bernardino. My name is Manijeh Badiee, and I'm an associate professor in psychology and in the Master of Science Clinical Counseling program. And this info session today is to discuss the program, some admissions requirements, and some different information, and there'll be a chance to ask questions as well. So first of all, I am going to introduce the program in general, and then I will talk about the requirements for the program. And I will also talk about some application information as well. So in terms of the program, so I think the easiest way to summarize our program is to look at what are the goals of our program. So we are a program that, first of all, in terms of units, 63 to 71 units. And the reason there's that difference is because it depends on which track you do. There's two different tracks. So I will talk about that a little bit later. But a minimum 63, a maximum 71. And essentially this program, we help you develop practical skills in counseling. And the way that we do that is through supervising your work. So what that means is that the first year that you are here with us in the program, out of the 2 years, you are seeing clients and you are doing it under our supervision, the supervision of the faculty. So you're video recording your sessions, we are giving you feedback on your sessions, and you have a lot of guidance on the whole process. And you start out slow with just one client at a time. And so that's through supervised training and also the experience that you'll get through your client work. And also the program, we are designed to provide you with the appropriate knowledge and understanding for a program in clinical counseling, as well as the research methods that would be important for this type of degree. It's not a research-based program, but there is some research training because it is important as a therapist to have some guidance in the research process. So in terms of program goals, specifically, we are trying to provide development of your skills in clinical counseling, so skills in providing therapy. We also want to help expose you to a variety of psychotherapy approaches, a variety of clients. And the second year, you actually will get the chance to go out in the community and choose a site of your choice. So that's another chance to have some exposure to different approaches. We also, for students that want it, it's not the majority of our students, but for students who do want to go into doctoral training, get a doctoral degree, we can help provide that preparation. And then also we can help satisfy the requirements for California to become a marriage and family therapist. And in order to practice therapy, mental health therapy, you have to get a license. And in the state of California, one of the ways you can practice is marriage and family therapy, consistent with other states. This is also how, generally other states have MFT programs as well, MFT licenses. But what we do is we satisfy the state requirements for you to obtain that degree. There are some additional requirements you have to do once you graduate, like you have to do more hours and also pass an exam. But those, we do provide the training, all the training that we can up to get you to be successful at those two things. So that's essentially the specific goals. Are there any questions so far? Okay, so I will go ahead and move forward. So I wanted to introduce our faculty. We are a wonderful team. I really enjoy our group. And so I'll just go from left to right. Actually, they're not in order in terms of the way that they're written, but I'll go in the order of the photo. So on the very left, you'll see Dr. David Chavez. He's the director of the program. And he is, he's been the director for a couple years now. And then Michael Lewin is next to him. And Michael Lewin actually will be the director, I think, not next year, but the year after. So if you end up coming to our program, you might have him as a director at some point. And then we have Dr. Jacob Jones, who is also an awesome colleague, and Dr. Maria Santos next to him. And then there's me, and then Dr. Christina Hasija, who is currently our department chair. So she is still involved in the program, but not as involved because she is busy with that role, but she does help when, as much as she can. And then next to her is Dr. Stacy Forcino, and she's actually the director of the clinic, the community clinic that is the place that you will see clients your first year. So that's our group. We get along really well. You know, we don't always agree on everything, but we do have a great relationship. And also we provide a variety of perspectives, you know, like Dr. Chavez, he does community-based research. Dr. Lewin does, you know, anxiety. Dr. Jones does things with neuropsych. Dr. Santos does community-based work and, you know, different harder to underrepresented populations, like specifically Latinx populations. I do work on resilience and empowerment. Dr. Hasija, trauma. Dr. Forcino does work on kids with behavioral disorders. So we have such a variety of different interests and different ways that we practice therapy too. So, so it's really cool because you get to learn from different approaches and find your own among those. Okay. So what do you, oops, skipped a slide. What do you get prepared for in this program? Well, you become prepared to become a marriage and family therapist in the state of California. Now, if you want to practice in another state, then it is a little bit different. You will probably have to do more things, like maybe pass their exam, but you'd have to check with the individual state. But it does prepare you to practice in California. And MFT is essentially a therapist that can work with individuals, but also can work with kids, teenagers, families, couples. So you get the variety of different types. So when people ask me which one should I do, because there's also one called licensed professional clinical counseling. And I ask them, what would you prefer to do? Do you want to work with kids? Do you think you only want to work with individuals? Or do you think you want to, you know, where do you think you want to work? And if you want to work with a variety of groups, then MFT would be the best fit because it prepares you to do different types, like couples and family and kids and different populations like that. So that's what I would say about that. And then in terms of becoming licensed in the state, you have to complete a degree that the state considers to meet the requirements. So when you're looking at other programs, which I really encourage you to do, you should never put all your eggs in one basket if possible, because even if you're a really strong applicant, you know, there's never any guarantees. So when you're looking at other programs, make sure that their master's degree does fulfill the requirements to become an MFT in California. And then you also have to have 3 hours of experience that are supervised. So you're doing therapy, but you're doing it under the guidance of a supervisor. And then you also have to pass the state licensing exam to become an MFT, which consists of questions in laws and ethics, which you will get prepared for in our program. But you actually take it after you graduate. So what else can this program prepare you for? Well, as I was mentioning earlier, you can also be prepared if you want to go into a doctoral program. because in the program, if you choose to, you can gain not just the clinical experience, which everybody will get that, but you can also, if you choose to, gain additional research experience. So basically, you can get additional research experience by completing the thesis track, where you would basically complete a research project that is in a topic of your choice, but that you develop with the guidance of a mentor. And generally, you're working with a mentor within the Master's in Clinical Counseling program, the ones that I just showed you. So generally, you want to work, you know, with them to develop your project, but that would allow you to get more guidance and research, perhaps publish or present it at a conference. And then that helps you apply to doctoral programs, because doctoral programs do tend to want some research experience. So that would help for that. So if you are interested in that, that's definitely something you can even start doing now. You can start talking to potential mentors and see if they're accepting students next year, because if you write that on your application, that does look pretty prepared of you. Like that's a way to prepare well, to, if you think you want to do a thesis, to talk to a mentor and to, you know, start even talking about your project, and if they're willing to accept you, if you do get accepted into the program. So so that's something you can start even as early as now, if you're interested in that track. So here are the courses that you would take in the program. You would take Community and Public Mental Health, Community Disaster Trauma and Resilience, Professional Ethics and Law, Multicultural Counseling, Neuropharmacology of Psychiatric Disorders. You would also take Advanced Psych Research, Lifespan Development Psychology. You'll notice that some of the classes are similar to what you took as a psych undergrad. Like you probably took a class in development, maybe abnormal behavior. So psychopathology is the graduate level of that. But there's also some additional classes specific to marriage and family therapy, like family processes, marriage and family therapy skills, child therapy. And then you're going to have classes like theories of counseling, clinical assessment, as well as marriage and family therapy practicum, and advanced practicum, which is your second year's practicum. So you have practicum, which is basically when you're seeing clients, and then you have a class related to that experience of seeing clients for the entire time that you're getting your degree. And then, as I was mentioning earlier, remember how I said there's a difference between the 63 and the 71 units, and it depends on which option you do. So if you do the thesis option, you do have to take, so some of the courses you have to take related to that would be either advanced independent study. Well, you would have to take that while you're working on your thesis, and then also either ANOVA or a regression, depending on what your project is about, and then some thesis credits as well. So for their, so with the comprehensive exam is the other option, and the comprehensive exam essentially prepares you for the licensing exam that you will take after you graduate from the program. So that's that. So for people that don't want to go into a doctoral program, are not particularly interested in research, and they want to practice when you're done with your degree, the comprehensive exam may be the best option for you. So with that, you take 3 units of directed readings where you're going to be studying for the comps exam, and then you're also enroll in the exam itself. So that's where the difference in units is, because as you'll see, the thesis option, you have to take several more courses related to research. And then an optional class that hasn't been mentioned yet because it's optional is, if you're interested in teaching, then there's a class that you can take in your first year, that if you take that class, you can sign up to teach in your second year. So that one is Psych 6630. And you have to kind of fit that in because you already have full-time load, plus you're seeing clients. So you already have pretty full schedule, but people can fit that in. It just will take some additional work. Same thing with the thesis. You already have a lot, so doing a thesis is a lot more on top of it. But for people that are motivated and really interested in research or really want to do a doctoral program, they can get it done. So what does your program look like if you get accepted? Well, year one is the clinical practicum experience that you do here on campus. We have a community counseling center. It's actually attached to the social and behavioral sciences building here on campus, but it's locked because it's got confidential information in it. And so you actually are seeing clients right here on campus, and you're supervised by one of the faculty in clinical counseling. As of now, the supervisors for next year will be myself, Dr. Michael Lewin, and Dr. Stacy Forstino, but that could change, but that's the plan right now. So you'll be given descriptions of all of us, and then you can place your preferences, enter your preferences anonymously, and then you will be assigned to one. Usually at least your first or second choice you will get. And then you'll go up to having 2 to 3 clients. Like right now in the fall, the students just have 1 client. So, but in the spring, they will possibly go up to 2 or 3 clients. So you actually start seeing clients pretty soon, like well within a couple months of your first semester. So you do get the basic training before you start. And it is nerve-wracking either way, but the good news is that you will be very competitive. So when you're applying for a site in the community, your second year, you actually have a better shot than a lot of other programs because you've already seen clients for almost a whole year. So that does help you when you're applying for your sites in the second year. So what about the second year? What does that look like in addition to your classes? So your second year, you are doing a clinical practicum again, but this time you're doing it out in the community in a site that you chose and that you applied to and they accept you. And it's just like applying for jobs. Generally students apply to multiple and then, go with hopefully one of your top choices. And you work about 20 hours per week there and up to 13 face-to-face contact hours. So that would be things like individual therapy, group therapy, anything where you're online. At this point, online therapy is video therapy is counting for that because of the pandemic. So that might change at any point, but as of now, it's still being counted. And this time, instead of being supervised by one of our faculty, you're supervised by someone directly at your site, because that's where you are most of your time. And they're going to be the ones that are an expert at the population you're working with at that site. So you're going to be supervised by a provider there. And some of the places that our students have been recently are the county, so San Bernardino County, Riverside County, as well as Yucaipa Calamesa School District, and also CAPS here on campus, which is the Counseling and Psychological Services here on campus. So that's some of the places that they've been to. Definitely doesn't encompass all of them, but there's just some examples. And in terms of, the 2 options, the thesis option, basically you have what's called, oh, okay, I see possibly a question. Let me look at the chat. Is it possible to be paid during the 20 hours per week? It is possible, but it is not likely because there's very few paid there's very few opportunities that are paid. So the county, I believe Riverside County has one. I'm not sure what the status is this year too, because funding has changed for a lot of places. So I would not count on it, is what I would say, because most people don't get paid for that second year. That's one of the hardest parts, I think. So well, not a lot, but some students still work. Now I will say it is hard to work full time just because you are doing the site 20 hours per week, and then also you're doing a full-time graduate course load, so you have to do all your readings, and so on top of that, trying to work full-time is a lot, but I think it's easier when students are able to just do part-time. At least that helps a little bit. There are other programs that you could probably find that do more nighttime classes that maybe you can go at a little bit of a slower pace, that you can potentially, it might be easier if you have to work full time, because ours is not really built for that, unfortunately. So, but people have done it, so it's not impossible. It's just that it's a lot harder. So in terms of the culminating experience, which is basically like how you kind of show you are done with this particular option, like it's like culminating just means like it's the accumulation or it's the collection of what you've learned. So for the thesis option, the culminating experience, the final sort of project that you'll do is that independent research project, where you're going to choose that topic with your faculty mentor, and you can interview different mentors. If you're interested in multiple people's research, you can definitely schedule time during their office. You can email them to schedule times with them, and then decide which one. It's you're not, you don't have to work with someone just because you met with them. And again, that's a good choice if you want to go to a doctorate program, or you want to do research as part of your career. And then for the culminating experience for the comprehensive exam, that is similar to the California MFT licensing exam that you would take once you graduate to become fully licensed. And you'll take that at the spring of your second year. And also, this is a good option if you plan to become a marriage and family therapist in the state of California. So how can you prepare to apply? Well, here's some of the courses that can help prepare you, that are actually, shouldn't say that you have to take to be prepared. So Psych 1100 or the equivalent. So you can transfer these courses into, as long as they're similar enough in content. So there's Intro to Psychology, there's Psych 2210, which is Psych Statistics, Psych 3311, Intro to Experimental Psych, and then you have a choice between Psych 3386, Intro to Psychotherapy, or Psych 3385, Personality. I really recommend you take Psych 3386, and generally it's offered every semester, and even in the winter and summer, it's generally offered. So it's more relevant to what you'll be doing. So I would suggest that one, but you can take Personality also. And then you also have to take Psych 3390, which is Abnormal Psych. And then here's some courses that are recommended, but you don't have to take them. So Psych 3351, which is Behavioral Modification, and then Psych 3391, which is like abnormal behavior, but it's for children specifically, so Psychopathology of Childhood. And then also Psych 4422, Advanced Seminar in Psychology for the clinical. And then this one is not offered as often, but if it is, it's usually in the spring. Psych 4432, which is also an advanced seminar, but this one's in research, specifically clinical counseling research. So those are courses that are also recommended to take, and they can just enhance your application. So what makes someone a successful applicant? Well, one thing is having clinical related work experience or volunteer experience. I would say most people don't have the opportunity to do this as a job, like to get paid, but some people do. Like, for example, some people have done applied behavior analysis. And so they have done something like they've done a type of therapy. And then generally they're getting paid for it. So that's an exception, but usually people have more volunteer experience because it's harder to have those opportunities. So one example of a place to get some volunteer experience is your local sexual assault services or domestic violence services. Generally, they'll have some kind of training that you can do, and then you can potentially do things like answer crisis hotlines, possibly accompany survivors to hospitals. So you're able to work more directly with people. And then also research experience can help you in the sense that it gives you some exposure to different areas of psychology, especially if you're in the honors program, the psych honors program. That does really make you stand out. The other thing research experience helps you do is it helps you get to know a faculty member, because usually you're doing that with a faculty member. So it helps you get to know them, and then they can write you a stronger letter. And that's really important to have detailed letters of recommendation. And so sometimes when you have a big class, you know, like when I have a huge class, I don't really know the students as well, but if somebody's on my research team, I might be able to write a lot more about them. So that also helps you write stronger letters. The range of grade point average is somewhere between 3.2 to 4.0. That doesn't mean everybody falls within that range, but generally that's the range. If you feel like your grades or your overall grades are not a reflection of your ability, like you feel like your ability is more than what's reflected in your grades, then you can explain it briefly in your personal statement. So that's another piece that I'm getting to, is that you'll write an essay called a personal statement. And then, as I mentioned, you also have strong letters of recommendation. The more detailed, the better. I suggest 2 from academic faculty, and then maybe 1 from a supervisor, preferably a supervisor that's seen you do some kind of face-to-face, or, you know, some kind of way that you're interacting with people, some kind of volunteer experience where you're helping people. And then the personal statement, I usually recommend past, present, future. So past is, you know, what led you to want to get this degree? What have you done as an undergrad to prepare? And beyond as an undergrad, if you've already, you know, time has passed. And also future, what are your goals that, you know, we can help you meet with this program? So those are some ways to prepare to apply. And then in terms of the personal statement, some more feedback, some more advice, get it done early so you can get a lot of feedback from multiple sources. I went through like 12 major versions with mine. It's just like a lot to, because it's actually like not that long, but you know, it's really actually that makes it harder, because you have to condense a lot into a small amount of time, so a small amount of space. And then also go to the Career Center for feedback. And the earlier you get it done, the more feedback you can get. Go to the Writing Center for feedback as well. And also, again, past, present, and future, definitely want to talk about, you know, your past yourself, but also make sure you balance it with what you've done, the present, your experiences, and also your aspirations or goals, the future. So you want to balance those pieces. Page limit, I think, I'm trying to remember, I don't know if it says a specific one on the application, but I would recommend probably 1 to 2 pages, single spaced. Yeah, actually maybe even less, like try to get it in 1 page single space if you can, but I would say like not more than, you know, 2 pages, yeah, I don't know. I think like 2 pages is probably, yeah, I think try to get it in 1 single space page, but I guess if you have to do 3 double space pages, but I would really try to do it in the 2 double spaced or 1 single space page. So application deadline is February 1st, 2022. And so you would first apply to the university. So you have 2 parts in the application. And then in the university application, you can get it through the Cal State Apply website. As of now, we believe there's a $70 fee to apply to the university. I wasn't able to confirm, but as far as I know, it hasn't changed since last year. We do recommend that you start that application at least 1 month in advance of the application deadline. So the application deadline is February 1st. So try to apply before that. And then also send 1 unofficial copy of transcripts from every college and university you've attended. It doesn't matter if you got a degree or not, you still would send those transcripts. So you don't have to necessarily get the CSU transcripts if you are from CSUSB. But if you are not a current student or graduate of CSUSB, you don't have to necessarily get your official ones until you are officially admitted. I don't know of any so the question is, are there any programs that help waive that $70 fee? I would definitely check with financial aid. I'm not aware of any, but it's possible that financial aid might have some programs, and also possibly I would check with the graduate studies. So if you just Google CSUSB grad studies or CSUSB financial aid, it'll give you the contact info. So I would definitely check with them to see if that can be waived. And then you also have to apply to the Department of Psychology. So our specific application. And so you also would upload those to the Cal State website, to Cal State Apply website. And for that, you need also the unofficial transcripts from each college or university. Again, regardless of whether you got a degree or not, there's a brief information form you fill out. And then statement of purpose, 1 to 2 page typed description of your preparation, goals, and professional aspirations. So again, 1 to 2 pages is what I would stick with. And then 3 strong letters of recommendation, at least 2 from instructors who can speak to your academic abilities. And then also recommenders will be sent an email with the link that allows them to upload their letters directly to Cal State Apply. So you just basically make sure that you ask your letter writers well in advance. I always ask for at least, I prefer at least a month in advance, because it takes me, I have to send them the information that I need from them to write a letter. So I would say if you know now who you want to ask now. It's not too early. Get it on their radar. And then that way you'll also know early if someone is not able to do that. So, and be as prepared as you can be when you ask people for letters, like know which programs you're applying to, what the deadlines are, how they're going to submit their letters, so they can decide if that's something they're able to do. So if you want additional information, please go to the psych webpage, and you can click on graduate programs and clinical counseling. You can also reach out to any of the MSCC faculty if you have any additional questions. Please, I would recommend, don't just apply to our program. It is very competitive. We get a high number of applicants. And so there's no guarantees, even if you're a very strong student, there's no guarantees. So just to, not set back your goals or your timeline, I suggest applying to multiple programs. And there are different Cal States that have affordable programs for becoming an MFT that are not too far, like Cal Poly Pomona, that or Cal State Fullerton, that you could also apply to. So that's just something to think about. So that concludes all of what I wanted to say. I really appreciate everyone being here, and I just want to open for any questions now. So someone's asking if someone's interested in working with children and looking for a mentor, and asking if Dr. Faustino is looking for a research assistant. That is a great question. I don't know, because I don't know what everybody's, looking for at this moment. I would reach out to her directly. So if you go to, and that goes for any of you that are interested in a particular mentor. So go to, if you just Google CSUSB psychology faculty, you can find the page that lists all the faculty. And if you click on the person, you can find their email address, and you can reach out to them, and you can ask them if you can meet with them to talk to them about doing research with them. So that's the best way to find out if a faculty is accepting students to work with them on research, or if they would accept students to work with them on thesis next year. As an MFT, are we able to work as a school counselor? There are some restrictions. If you want to do school counseling, there's probably better options out there, because there's programs that are designed for school, specifically for doing counseling in school. So we've had some students interested in school counseling, and what they had to do is they ended up getting an additional degree on top of their on top of the MFT. So I would suggest, if that's what you're interested in, looking at going to maybe looking at different kinds of programs that are more geared towards school. Like you could look into the counseling and education and guidance program at Cal State. also. So that might be one to look into if you're interested in educational settings. How many students are accepted? We get around 80 to 100 applicants usually per year. We usually interview about 25, then we accept 12, and then depending on who accepts or not the offer, we go down a waiting list. So the applicants are rated and then we go down the waiting list. So that's about, so it ends up being that every year we have a cohort of 12. My office hours are at Mondays and Wednesdays, 10:30 a.m. to 12:30 via Zoom. If you want to know the link, you can feel free to reach out to me and I can send you the link to my office hours. You can email me if you want, and I'll send you that. The cost, I don't know the precise cost. I would go look at the Cal State, like the graduate studies website, and they should be able to tell you the cost, and then you can determine, because it'll tell you the cost per unit, and then you can multiply it by the by which option you would do, like the thesis or the comp exam option, and then that would tell you how much the program would cost. Are there financial aids and scholarships available? Absolutely. There's some scholarships that are just for our students, just for the clinical counseling. So with a cohort of 12, you have a good chance of getting them. Also, you can apply as early as this year for scholarships for next year. So there's a scholarship application that CSUSB has that opens around I don't know exactly when it opens, but I think it's usually due around February, but look for an email from the campus. And like it takes you have to do a few essays, but if it's worth it, if it takes you a few hours but you get a few $100s, like that's worth it. So look for the scholarship application that CSUSB has, and then there's options that you can fill out there that you can be eligible to apply for the ones that are specific to our program. What option do you recommend, the thesis or comprehensive exam? Well, as I was saying, it depends on what you want to do, right? So the comp exam is for if you want to practice right away, or if you want to, basically if you want to practice right away and you're not really interested in research, if you want to do research or you want to get into doctoral program, you would do the research option. If you want to have the PowerPoint sent to you, please email me. I can't take notes right now, it's recording. So you can definitely email me at mbadiee@csusb.edu and I can send you the PowerPoint. And that's also, you can email me if you need my office hours link too. Are there any other questions? All right, well, thank you everybody for coming. Oh, okay. Thank you everybody for coming. I appreciate just you being here, and yeah, feel free to email me if you have any additional questions. You're very welcome.